Here's what's new in infection control. A wrongful death and malpractice lawsuit recently came out against the Asant Rouge Regional Medical Center in Medford, Oregon, on grounds of negligence. The suit says that the hospital failed to monitor medication administration procedures and prevent drug diversion by employees. This comes from the arrest of Danny Marie Schofield, a former nurse at the hospital, where she was arrested on 44 counts of second-degree assault. The assault charges stemmed from a police investigation into the theft and misuse of controlled substances that resulted in patient infections. The lawsuit states that in December, they were informed that an employee had been replacing the medically prescribed fentanyl of patients with tap water, which led to a series of patient infections. Fentanyl is a powerful synthetic opioid that has helped fuel the nation's overdose epidemic, but it is also used in legitimate medical settings to relieve severe pain, and drug theft from hospitals has been a long-standing problem. Medford police started the investigation late last year after hospitals noticed a troubling spike in central line infections from July 2022 through July 2023, and told police they believed someone was diverting fentanyl. The complaint states that, quote, all plaintiff patients were infected with bacterium uniquely associated with waterborne transmission. If you'd like to learn more, you can find the full story from medpagetoday.com using the link in the description. And for more videos like this, keep it here with Sterilizer Autoclave Solutions. Don't forget to like and subscribe.